show me?
Here. On this side.
Just talk me through what's been happening with this.
So I am feeling the pain from here all the way. Sometimes it shoots down.
How far down?
Around here. Not all the way down to the foot, but like on the hamstring.
Okay.
Up to the half of it. When I stretch it out, it gives me a relief actually, but only when I like stretch it out further or like bend. Most of the time when I sit or when I drive, that's when I feel it. So I have to like stand up and like move around. What else?
Talk me through some history about how long it's been going on now.
It's been ongoing for 2 years now. Maybe even more, I can't remember. But I've gone to a couple of other sessions with other chiro, but there's only one session, and then after that I feel okay, and then it will come back again. So it's a recurrent thing that's been happening.
So what made you prompt you to come here then? What?
I've seen reviews from your Google reviews, and I saw that people were getting better, so why not try it? Yeah.
So you're looking for a more permanent solution to get this thing sorted out.
Yes.
Is there anything else in the neck and the shoulders?
Yeah, so I feel some tension in the neck, but it's on the other side, which is weird. So sometimes it shoots up and it's causing me migraines, especially when I'm, again, seated all the time because of office work.
I see.
So, yeah.
And this would you say these issues are affecting you at work? When is it affecting you?
Yes, definitely. I mean, my whole day, because then when a migraine shoots up, it's difficult for me to focus at work, and then I would have to drink a lot of pain reliever, which is almost a recurring thing now.
And how much? What pain relievers have you been taking, and how often have you been taking them?
Brufen, sometimes Panadol migraine, sometimes Panadol, the red ones, the strong ones. It gives me temporary relief, and then again I'll feel the pain like in a couple of days to come.
I see.
Yeah.
So it's something I assume we're not wanting to get used to, huh?
Exactly.
And
exactly.
So before initiating here, how often were you experiencing these migraine headaches?
I would say probably in a week there will be like 2 episodes of like not severe but like bad migraines.
Yes.
Yeah.
Yes. Yeah. Okay. So we've got this migraine we need to get control of.
Yes.
This neck pain, this pain going down the leg. All right.
Exactly.
So I expect, with our care, for you to
Yes.
function great, to feel great, to get this. Once we balance these systems in the body and get healing nerve flow going throughout your body, we'll get this sorted out.
Please.
All right. Let's get to work. Let's have you lie on your front, please.
Thank you.
You tell me which one is most under. Number 6, number 5, number 4, number 3, number 2, number 1.
And now it's more on the 6.
Number 6.
Right, yeah.
Once we balance this area, it's going to help the nerves on both sides, okay?
Right.
Turn to your side, please. You. Lie on the other side. Lie on your back. This is going to help with migraines. It's going to take them away. It's going to help your head feel perfect. And it's going to help the nerves going into your shoulders. Sit up for me. Less tender?
Yes. Much better than what it was yesterday.
How's your body compared to yesterday?
Actually, the pain is much better today. Like, I still feel something there, but way better than what it was yesterday.
So yesterday there was a lot of discomfort when we started, yeah? So just tell me the change between yesterday and now.
So yesterday I would say the pain was probably around 8, 9, that painful.
Wow.
But there's like, it shoots. So it shoots with that pain and then it subsides a little bit. But today I would say I'm around like 4 or 5, yeah.
Wow, so it's gone down by like
exactly.
a half or something. Yeah,
exactly, yeah,
perfect.
Way better. And I felt it right away. And then when I started driving, I could feel a little bit of the pinch again, but not as worse as when I started.
Wow. Is that a positive sign for you so far?
Definitely, definitely, yeah.
God willing, we'll get this thing sorted
Thank
out.
you.
You take care, man. All right, we'll check this again next time.
Thank you so much.